This is basically going to come in handy if your dog has had a surgery or an injury that they're recovering from, if they had their leg in a cast for a while, or if they have a knee injury. I mean, knee surgery is probably the most common orthopedic procedure done on dogs, and they really benefit from physiotherapy following that. Another scenario in which you might be doing this is if your dog has had back surgery or a back injury or an intervertebral disc disease, and you're taking a medical approach to managing it, and you're just kind of trying to mobilize their muscles and just help them recover their strength and sense of balance. So the very basics of physiotherapy, there's two things I'm going to show you today. One is range of motion exercises, and the second one is just a little bit of basic massage. Now, range of motion exercises are meant to mobilize a limb, get it moving, particularly if it's been stiff or not used for a while. Again, I'll work mostly on the hind limb because the hind limb is the most often affected in dogs. So you see this handsome muscular leg. Now, if this leg was in a cast for a while, you'd probably lose a lot of muscle, called muscle atrophy, and you'd probably have a stiffening of the muscle and the tendons, which would make it hard for him to move his leg normally. See, a normal dog can flex that leg right up and extend it all the way. So the goal of passive range of motion exercises is just to move the limb through the normal range of motion from maximum flexure to maximum extension or standing extension to the limit that your patient allows you. Now, this can be quite painful, so you want to make sure that your pets have some pain control on board, and you want to make sure you're not pushing them too far. So the way I do this is just let them rest their foot and just test to see where they're comfortable. And it might be just a little bit flexure, it might be flexing all the way. And we really just want to move that leg up and down. It's okay, you want to sit down? That's totally fine. We'll use the front leg. So you can do the same thing with front legs. Just, for example, if this was for the elbow, we'd be moving the leg like this, and we'd find a little resistance. So Cedric's resisting me a little bit now, and say, okay, well, this is a maximum flexure that you're comfortable with. And then we'll just work within that range, up and down, up and down. And our goal is to do this 10 to 20 times, 2 or 3 times a day. Now, if we're recovering from surgery, that'll be more than enough to get blood flowing back to the limb and just start stretching out the tissues. And our goal is to get to normal. So if his range of motion is less than normal, we just want to get him right to the edge of that without causing him any discomfort. Just get to the edge of that. And you have to be a little bit sensitive, you be aware of your pet's comfort level because we never want to do anything that hurts them. Just get them right to the edge of where they're comfortable and work just within that range.